The goal is really to provide an alternative treatment for patients who have seasonal allergic rhinitis, nasal allergy, not responding to medications. Adults and children, at this point primarily adults. This treatment actually is being really marketed through the allergists and the otolaryngologists and people that are able to deal with the local reactions and to really educate their patients. And it's not indicated for every patient. There are some patients for which it's not recommended. I think if you have a very bad grass allergy season, in our part of the country, in the Midwest, it's from May through June, or if you have a bad ragweed pollen season, August through September, in those times of the year, and you're not controlled with medications, have not been controlled with medications, this might be a treatment you really want to consider. For patients who have moderate or severe asthma, or patients who have had reactions to injection therapy with allergen injections in the past, it's not recommended. Any patient who has had a systemic reaction, allergic reaction, or anaphylaxis to anything, this treatment is not recommended. If you have more severe asthma, theoretically, you'd be more likely, or if it's uncontrolled, more likely to react to any form of allergen immunotherapy. Sublingual not excluded from that. However, there have been studies testing these sublingual tablets or sublingual therapies in asthmatic patients. They seem to have some effect in asthma, although there haven't been enough studies of large enough size that would allow these for that use to be approved by the FDA at this point. Well, the pills and the nasal sprays don't work for a lot of patients. So there maybe at least 40% of patients who are not really satisfied with the results they're getting from nasal steroids or antihistamines, and this treatment would be indicated in that group. And this is really suited, I think, more for the patient that has seasonal allergic rhinitis. They're relatively okay during the rest of the year. The meds can really control their symptoms during other times of the year, but they have a really bad season where nothing seems to work. If they don't want to do shots all year round, taking these sublingual tablets before the season and during the season may be a very attractive alternative. They start before the season, usually 12 to 16 weeks, continue through the season, and then discontinue usually at the end of the season. Not necessarily, because allergen injections are indicated for patients who have multiple allergies that are clinically important, so that they require year-round injections to control their perennial as well as seasonal symptoms. At this point, the products that are available are pollen sublingual tablets, and these treat primarily seasonal allergic rhinitis to grass and to ragweed sufferers. It's not indicated or not usually permitted if you're already on injections to receive a sublingual tablet, but you can certainly take sublingual tablets along with medications. Most of the side effects are common. They're common local effects, which occur initially within the first week of starting this. They're transient itching under the tongue and some irritation, but these usually subside within a few days. There is a small risk of systemic reactions where you have reactions beyond the site of the application of the allergen under the tongue. You can develop some chest tightness, but these are usually very mild, but patients should be watched and observed in the clinic after they take the first dose of the sublingual tablet, just to make sure. We treat with epinephrine, and the FDA has required that all patients on sublingual tablets have their own epinephrine auto-injector and be trained on how to self-administer in the event of a very unusual systemic reaction. But these events have been relatively uncommon. There are other sublingual treatment allergens in development. The big one now is house dust mite. And there have been several studies in Europe, and the results look very promising. There was a large study done in the United States, and it will be reviewed very soon by the FDA. It's costly, but I think reasonable compared to if you were taking injections and all year round, and this would continue with having to have allergen extracts prepared. For those who really only need this type of treatment for certain times of the year, it does make a lot of sense, and also reduces the need to take medications, reduces the cost of medications as well. Well, I think developing different allergens, the dust mite should be quite exciting. This would be available to patients who have year-round perennial allergic rhinitis. This treatment would also be very suitable for children, because children have a sort of a natural fear of injections, so this would be an alternative. And what's very interesting is, can we prevent development of asthma if this type of sublingual treatment, particularly for house dust mite, is begun early in life? Will that prevent progression to more severe nasal allergy or allergic asthma?